a copy of the slides and a link to the recordings. So you can sit back and watch the webinar without taking notes. Okay, so I'm Anita Kayat. I am a SCORE mentor, and I will be presenting the group home webinar today. But before we do that, we're going to talk a little bit about SCORE. So for those of you who are not familiar with SCORE, we are a network across the whole entire United States. We have the largest network of free volunteer small business mentors in the nation. And no matter what stage your business is, we can find a mentor. As I said, we have 250 chapters across the United States. And that means we have approximately 10,000 mentors that we have access to. So even if you have an odd type of business, we can tap into somebody who has the background necessary to help you. So don't hesitate to come and ask for a mentor. So I will, in a little while, show you our website where you can sign up for a mentor. Our mission is to foster vibrant small business communities. We do this through mentoring and education, such as this webinar. We hope that we are able to give every person who's starting a business the support they need to be successful. We know that small businesses are critical to our national economy. More than 95% of all businesses are small businesses. So they are really critical, and certainly in the Cleveland area, we have seen the downtown area revitalized in the last couple of years solely due to the new small businesses that are starting in the area. This is a snapshot of what impact we had nationally last year, and you could see that we helped start over 30,000 businesses and 152,000 new jobs. We have all types of entrepreneurs that come to SCORE. We're very proud that more than half of our entrepreneurs are women, and approximately 10% are veterans. We have a code of ethics that will protect the information that you share with us. Not only that, but we are certainly not permitted to share your information with other people, or are we able to make money from any information we learn from you. This is a snapshot of our website. If you go here, you can sign up for a mentor, or if you want one in your area, enter your zip code down here and it will come up. There will be a small form that you have to fill out. And I will say, if you give us as much information as you can about the type of business that you want to start, we are more able to match you with someone who would be compatible and be able to help you. So again, you are going to get a copy of the slides and a link to the recording. All of our services are free, partially because the Small Business Administration supports us, but also a lot of the banks and other businesses in Cleveland provide support to us because they want our small businesses in the community to succeed. Here's a link to our website, both a QR code. And again, all the links that are in this presentation are live, so they should lead you directly to the help that you're looking for. Just a small aside that this next month in September, we will be doing a repeat of the Cleveland Connect that we did, I think, in 2023. And it'll be an opportunity for those of you who are clients to come and meet volunteers and to mingle with them. And we will be having a discussion, a panel discussion about my biggest mistake, so you can learn from somebody else's experience. Okay, so let's get started. Let me just take a second here to see what. Okay, someone's asking, how does a group home differ from assisted living or retirement home? So, and what are the financial obligations? Both of these we are going to be talking about during the presentation. So if you don't mind waiting till we get to that section, we'll go ahead and do that. Now, okay. Somebody's saying that they're unable to see anything. Just see the top of my screen. I think that might be a problem with your computer and not our presentation. So anyway, let's go ahead with starting a group home in Ohio. So, and if you're not in Ohio, everything is going to be pretty similar. But as we go through, I'll mention probably alternatives for you. So just shortly, what gives people feelings of power? Money, yes. Status, of course, but helping others be better is something that really makes people feel good. And so I think as you, of a small business owner who's thinking of starting a group home that's going to help other people, should give you a good feeling and a feeling of power. So today's agenda, hopefully by the end of the session, you will understand what a group home is and what types of group homes there are. There are many different types. What are the things you need to do to start a group home? And I'm going to give you some resources where you can go for additional information. So congratulations, starting a group home is a wonderful thing to do, but it's also a great challenge. Whether you're starting a small group home with 6 or 8 people, or you have in mind a large complex, there are very similar steps that you have to take for all of those group homes. So think about your business goals. Why do you want to start a group home? Is it because that seems like the popular thing to do? Are you interested in helping a particular group of people? Many people who start a group home have had either their own experience or experience of a friend or family member that leads them to want to particularly help that group of people. Of course, starting a group home, it's possible to make money. But there's a lot of work that goes along with it. Comes with a very hefty dose of responsibility and hard work. And just to quote Thomas Edison, opportunity is missed by most people because it's dressed in overalls and it looks like work. And starting any kind of a business is a lot of work. So, are you ready to start a group home? Just being motivated probably isn't enough. One of the things that's very helpful is if you have started other businesses and you understand the steps that you have to go through in order to start a business, that's very helpful. Also, if you've worked in a group home, if you've had association with a group home in some way so that you understand how it operates, what the requirements are, and so forth, that's very helpful as well. do you have a home or facility? Some people have a house or some property that's available and putting it to use as a group home may be one opportunity that you might want to use it for. If not, are you going to buy a property? Are you going to lease a property? And if so, do you have funds available? Most properties are going to need some sort of renovation or build out because of the requirements for space, the kitchen, bathrooms, and so forth. So, and if you need funding, one of the major issues with lenders is what qualifications and experience do you have in running a group home? So, and regardless of the type of lender, they will expect if you need $100,000, they'll give you 80 or 90 and expect you to contribute the additional. So you will need some funds in order to get started. So what are the types of group homes? And just for your information, there are more than 750 group homes in Ohio. So the ones for children, child daycare facilities are considered group homes. Adoption or placement group homes. There are homes for young people aging out of foster care. So it would be the 18 to 20-year-olds who are out of the foster care system. There are addiction or recovery group homes. And then there's just standard foster care. For the elderly, and again, we'll go into more detail later on, but just to make you aware of how many different types of group homes there are. There's adult daycare, and of course there are residential care, nursing homes, hospice care. There are homes for people with mental or physical disabilities, although people now with mental or developmentally disabled people are not having licenses at this time. So that's one you probably won't see. And of course, there's sober living houses, halfway houses, veterans, maternity houses. So there are a huge array of types of group homes for adults. Unfortunately, every type of group home has different state and local regulations, and different impact from the different government agencies that oversee them. So in Ohio, there's a list. If you click this, it takes you to a checklist where you can get the legal requirements for various types of group homes. If you're interested in mental health or addiction, this link will take you to Ohio residential care facilities. Now, most other states have very similar situations where in Ohio, it might be Indiana or Kentucky mental health and addiction services, but they're all on the state website. So if you're not in Ohio, you might just want to go to your state website and look for the same departments. And then the Ohio Department of Health or your state Department of Health has the regulations for assisted living facilities. So if you think about a group home, you have to think about the market. Now, the population of the Cleveland metropolitan statistical area is over 2 million, but approximately 14% are over 65. So maybe if we're talking about older adults, we're talking in the neighborhood of 300,000. already approximately 6% are either in assisted living or nursing homes. And approximately 6% are under 5 years. So if you're thinking of a child care facility, that would be the number. Bear in mind, there are approximately 23,000 homeless people in Cuyahoga County. And the population below the poverty line is 31%, which is a pretty large number. So when you're thinking about your assisted living or your group home of some sort, keep in mind that a lot of the older people who retire move to warmer climates, and the people left behind are not necessarily people who have large retirement income. So that's one thing you need to think about. So according to the Center for Disease Control, 23% of those over 65 are in poor health. And of those not currently institutionalized, about 10% have difficulty with, say, self-care. So based on your market size, figure about 10% of those over 65 might be potential clients for your group home. And then when you think about a group home location, you want it to be accessible so that family members are easily able to get to it, so they'll visit the residence. Also, you might want to have field trips and so forth for your customers. So having it near interstate freeways, or at least accessible, it would be ideal. You also would like to have adequate parking for the same reason. And it would be nice to have sidewalks so that residents can be outside and can walk around the neighborhood, because a lot of them, again, are going to be physically able, and you want to have the ability to walk and visit the neighborhood. The one thing you have to be very concerned about before you take, or even if you already have a home, is what are the zoning laws? A lot of communities have laws which limit the number of unrelated people who can live in a residence. So that's their way of making sure that they don't have group homes in their neighborhood. So also think about the labor market, because you'll need to hire people to work in your facility, depending on, again, the type of facility. You may actually have to have staff 24 hours a day. And now, right now, current facilities have major staffing problems, primarily because, again, if it's a Medicare or Medicaid facility, they might be unable to pay competitive salaries because they just don't have the income from the insurances. Employment rate is low, and inadequate numbers of trained personnel. So even if you have a non-medical type facility, your staff will need to know CPR, need to know safety, especially working with people who might have disabilities and need help functioning, and any kind of special needs. So think about that when you're thinking about setting up your group home. So let me stop there for a minute and see what questions we have here. Okay, so we're talking about a nonprofit or, and yes, and we will talk about that. A respite type home would also be considered a group home. Curious about the comment about developmental disabilities not being licensed at this time in Ohio. The Department of Developmental Disabilities is not providing any licenses for group homes. So they may open that up in the future, but right now they don't have anything. So again, you will get a copy of the presentation and you will also get a link to the recording. So yes, the number of homeless in Cuyahoga County is about 23,000 and about 31% under the, okay. Okay, what should we take into consideration aside from zoning? I think that those are the things we just talked about. So let's go forward. So where do you start if you want to do a group home? First of all, you want to make sure that if you have a group home set up, that you're going to be able to recruit residents. So you want to work out what is the demand. So one place you might look is to check the websites of the agencies that support specific homes. So if you're looking at sober living, you might want to check the Department of Mental Health and Addiction Services to see what they are doing as far as supporting group homes, whether they are identifying the need for various levels of group homes, and we'll talk about those levels in a little bit. Are they seeking providers? You might look at their annual report to see what their plans are for the upcoming year. Identify current facilities. And you can do that by going to the local library and getting a list of facilities, or you can probably even Google it. How many assisted living facilities are in my county or my state or my city? But the reference library at your local library can also help you with that. So you want to identify the current facilities. Do they have waiting lists or do they have vacancies? If there are a lot of vacancies, you might want to reconsider unless you have something that's particularly compelling. How many residents do they have? And you, again, go back and look at what the statistics are. And then again, use the available research data, and we'll give you a link to that. So you don't have to be great to start, but you have to start if you're going to do a group home. It's important, again, to make sure that there is a need for the type of home that you're interested in starting. Now, do you want to be a nonprofit or a for-profit? One thing is, what is the purpose of your business? If your primary purpose is to help a particular group of individuals, your focus then is more on the services, then you probably want to be a nonprofit. If your primary interest is making money, then you probably want to be a for-profit. Many, of course, are going to be some combination, and what you decide on probably might be influenced by the agency that oversees them. Some of them do require nonprofit status. A lot of them don't. You could be nonprofit or for-profit. The funding sources are going to be different. If you're for-profit, you can go to a bank or other types of lenders and get a loan to start your group home. If you're a nonprofit, traditional loans are not available. So you either have to do fundraising events, find donors, or find maybe granting organizations that will support the type of group home that you're interested in having. So for-profit versus not-for-profit may have a slightly different connotation of your audience, your customers. If you're a for-profit, you generally will think of your clients as your customers, whereas if you're a nonprofit, you think more of clients needing services. A big difference between nonprofits and for-profits is the leadership of the organization. If you are a for-profit, you own your company, you make the decisions, what you're going to do, how you're going to do it, and it's totally up to you if you want it that way. You don't need a board of advisors. You don't need a partner. It's all up to you how you want to run your organization. If you are a nonprofit, you must have a board of directors. And once you set up a nonprofit, it becomes what we call a public benefit organization. It does not belong to you. Nobody has ownership. The board of directors is responsible for making the business decisions and driving the company towards satisfying your mission. So again, that's a big difference. So you want to think carefully about that. And if you decide to go as a nonprofit, then it's very important who you choose to be on your board and who you recruit to work with you to build your company. Organizational culture is generally different if you're a nonprofit or a for-profit. Again, if you're a for-profit, you're probably working towards being very cost-effective and frugal in your expenses. If you're nonprofit, you're going to be purpose-driven and your work is going to be more towards how can we provide the services we want to provide to our clients, not how can we cut costs. Taxation is different. If you're a nonprofit, you don't have to pay federal tax. However, you do have to pay employee taxes and those kinds of taxes. You don't have to pay income. You do have to pay certain taxes that are required, but not federal taxes. And again, if you're a nonprofit, your hope is that you will be able to recruit volunteers that you don't have to pay that will do the same jobs that staff would do if you were a for-profit. So we generally think of maybe 10 volunteers to every paid staff member for a nonprofit. So if you're going to do this, you need a business plan. And we have a lot of tools available. There's one called the SCORE Startup Roadmap that has 12 modules that you can work on and then work with your mentor. You may not do all 12 of them, but they will help you get started in your business. I recommend that you download the workbook for simple steps to start your business, because it goes through all the steps that you need to start a business. And along with that, you can go to our website and view the 5 webinars that cover basic business, marketing, finance, funding your business, and so forth. So it's a good support system. There's also a website called B Plans, where you can go and get some sample plans. The particular one that I have here has a category called emergency shelters, but it has something similar that you can download, and you can kind of use it as a guide, and many of my clients have found it very helpful. You can also actually go to an artificial intelligence site and put in some prompts and actually generate a business plan guide as well. Also, there's the business model canvas, which is a 1-page sort of brainstorming tool to help you get started. So if you meet with a SCORE mentor, you can look at these and make a decision on what's going to work best for you. And the Chat GPT is one artificial intelligence link that you could use to generate your own queries. So the elements of a business plan. The executive summary is really the last thing you do, but you normally would start with your mission statement, a discussion of your company background, what are you offering? What are your products or services that you're offering? What is your marketing plan? So even if you think, well, I'm a nonprofit and I'm providing services that people need, they still need to know about you. You still need to be able to raise awareness. And if you're a nonprofit, your marketing plan also has to include how you're going to raise money, how you're going to recruit donors, and so forth. So marketing plan is very important. You also want to do a competitor analysis. What are other businesses similar to what you want to do? What are they offering? How many clients do they have? What services are they providing in addition to the basic care? So you are looking at that with the idea that you want to differentiate yourself from those other competitors so that people will want to use your services as opposed to somebody else's. You want to do a SWOT analysis, which is really a look inside. What are my strengths and weaknesses as a business owner, and your opportunities and threats based on what's available in the community that I can work with. Then you want to also have an operational plan. You know, once a person walks in the door, how are we meeting with them? How are we treating them? Where are they located? What do they need as far as services? So you need to think about operationalizing your plans. A critical one, of course, is financing. How are you going to finance your business? How much money do you have to invest in your business? And then a timeline. And a lot of times it works out, say, I'm going to open my business in January, and so I can work back from that. I know it's going to take me so long to get my website up. It's going to take me so many months to build the financing I need, etc. So you can kind of work back from that to build a schedule for doing your business. Okay, so I'll stop there for a minute. And I did mention maternity housing for somebody who asks. Let's see. I think I cut most of those. Let's just look under the Q&A. What are the problems associated with group homes and how do you evict the residents? That's an interesting one. We'll leave that to the end. Okay, yes, I mean, there are certainly state or agency regulatory codes on staffing and so forth. So can any of these stats be generalized to reflect other Ohio counties? Yes, they're all available. If you go to the US Census, and I think I have a link to that at the end, you can get the same information for other counties, other states, other cities, through the US Census Bureau. So what is the website for group home rules? And now we're just going to get into that detail. How long has it been since the Department of Disabilities? As far as I know, at least the last 3 or 4 years, they have not provided licenses. So let me go on and we'll see. Hopefully we'll answer some of your questions, but if not, we'll try to do it at the end. So child daycare, if you're interested there, you can have the daycare in your own home. There are 2 types, type A or type B, up to 6 children, or the larger one, 7 to 12. They need to be certified. And if you have children, they count in that number. So if you have 4 children and you have a type B, you can only add 2 children to that. And this is a link to Starting Point, which is an organization authorized to certify child daycare. But it's also a great resource for learning about what are the requirements, both for in-home or outside, separate group homes for daycare centers. They do the training that's required, and there is training required for child care centers. So if you're interested in a child care center, by all means, go to Starting Point first, and then your SCORE mentor can help you work through that. But that is such a wonderful resource that if you are interested in childcare, that's the place to go. So the different types of group homes for children are regulated by the Ohio Department of Jobs and Family Services. And again, they include all of these types of services. So they're all, regardless, they are all under the Ohio Department of Jobs and Family Services. So you can go to their website, you can find out what the regulations are for each type of group home and what payments are available. And obviously there are payments available for different types of services. If you want to do a private child placing agency where actually you have legal responsibility for these children, and generally it's like a holding facility because you're looking to place these children either for fostering or adoption. And the alternative is that you could have something similar where you work with the private placing agency. So you actually house the children for a short period of time. and you participate, but you don't have the legal responsibilities for the children that you do if you have the placing agency. And again, you would work through the Ohio Jobs and Family Services. For young people transitioning out of foster care, there is a program called Bridges, and it's for young adults who, leaving foster care, don't really have any place to go, but they must be in school or working or participating in some sort of a program, unless they have a medical condition that prevents them from doing that. And they would qualify for a payment of up to $5,000, which would help pay their room and board for approximately a year until they were able to go out on their own. And again, it's administered by the Ohio Department of Jobs and Family Services. And again, if you're in a different state or a different, different state, basically, you probably have something very similar to the Department of Family Service, Child and Family Services. So those are for children, and for adults, there are a number of levels of care. So if you're thinking about a group home, you want to think about what level of care would you provide. The level one is really the activities of daily living are mostly provided by the resident themselves. They might actually want to have help taking their medication or something, but mostly they're pretty much independent. They're just wanting to live in a social and safe situation. Level two, again, probably relatively independent, but with maybe need moderate help with the activities of daily living. And then level three is at the point where they require a lot of additional help. So if you have a assisted living, you might have one of those three. Adult foster care, and that's where you would have again, a small number that are living together. They're regulated by the Department on Aging, which provides a small amount of funding, but most of the funding for those homes are going to come from private pay. So the individual is going to have to pay most of the required the cost of the care. And here's a link to the Department of Aging. Again, under some circumstances, they will provide a small amount of support, but not a huge amount. Now, adult daycare is also considered in the group homes. It's where you would provide meals, recreation, perhaps some health-related services. Again, you might provide medication help, that sort of thing, but not a lot. It's mostly for socialization and actually just to have a place to bring a senior person who really can't be at home alone all day. So it's a type of thing that if you're working and you have a parent or relative that you're taking care of, but you can't leave them alone all day, adult daycare center would be an alternative. And again, there are ones that provide more social activities or more health-related activities. And again, there might be some that provide only very special care recipients. Now, these daycare centers are not licensed in Ohio. So you don't need a license to do this. But if you want any payment, then you have to go to the department that covers it, and usually it's Medicaid, and follow their requirements. So here are the guidelines for adult daycare centers. And that would tell you exactly what you have to do as far as space, as far as facilities, and what you have to provide for them. For disabled residents in Ohio, there are 12 centers for independent living, and they provide services to individuals with disabilities. Now, that they do not provide residential. So if you want to provide a group home for people with disabilities, you might want to figure out where's the closest independent center. So traveling to those centers would not be too far. The one in Cleveland is on Lorraine Avenue. So if you're thinking about a group home for people with disabilities, think about where you can locate it so that traveling to the LEAP Center is not going to be far. So those centers really help people with disabilities find employment, give them opportunities for ways to make themselves useful and helpful, and use the abilities that they have to be effective. So a lot of you are probably thinking about just generally assisted living. These are residential facilities. They are regulated by the Department of Health. And again, they can be in 3 different levels, as we saw earlier, that they could be pretty independent with minor help. They could be a little bit more or like totally dependent. So you can decide which ones you want to have, but if, there are many residential care facilities that start with assisted living and then move into a skilled nursing facility in the same location, so that once a person commits to assisted living, they will not have to leave and go somewhere else if they become more disabled. And they're housing for, again, recovery services. They're called recovery residents. And again, there are 3 levels, and we'll talk about that. But even if you don't provide treatment services, staff are going to be trained in recovery support. And these are licensed and regulated by the Department of Mental Health and Addictive Services. So there are 3 different levels. So the class 1 level is the most comprehensive, because they not only provide room, board, and personal care services, but they also provide the mental health services. The class 2 provide the accommodations, supervision, and personal care services, but they don't have on site the mental health services. So if you want to have a class 2, you want to make sure that the residents are going to have access to the mental health services that they need. The class 3 are really room and board for 5 or more unrelated individuals. So these people are pretty self-reliant. They go to their mental health facilities. They just need a place to stay. So it's the lowest level of care that you can provide for these people. So again, the Department of Mental Health has a complete set of rules that you can go through. It tells you exactly how much space each of the individuals need, how many residents you can have per bathrooms, what type of oversight is required for staffing, mental health personnel versus regular staff people. So it's a very detailed program. Also, on that site, there's a list of the types of funds that are available. So this is a Department of Mentally Challenged. Again, they're currently not being licensed. You can, and I don't know about other states, so I would suggest that you go to the Department of Developmental Disabilities and check and see if they're being licensed or not, and what funding is available, because generally there is funding available. Now, recovery houses or halfway houses include houses that would monitor offenders who are under community supervision. So they're trying to reorient into society from coming out of prison. It's generally in conjunction with the Ohio Department of Rehabilitation and Correction. And again, they work with you very closely. They monitor, they will provide some funding. So this is a very specialized type of group home and takes very special type people to run these homes and work with the Department of Correction. So then who pays for care? And now you might find, because insurances are working towards trying to keep people at home, that there is some possibility that you might be able to qualify as a caregiver for some payment. So you might want to look at that. But funding for your group home really depends a lot on which direction you choose to go. If you want to be a nonprofit, you want to look for the agencies that support your type of group home. You might participate in pitch contests. In Cleveland, the Cleveland Foundation supports these types of agencies. Also can do fundraising events, look for donors. So the issue really is that it's almost impossible to get a bank loan. So you have to be creative about how you raise funds. If you're a for-profit, again, you can go for traditional bank loans. You might want to get investors. So their funding options are more available if you're for-profit. And we have an article on our website on finding fundings. So the costs. Now, again, if you're doing assisted living, most assisted living have two options: a single monthly fee that covers everything, or fee for service, where they charge you a basic fee, and then depending on what activities you want to participate in or what services you want to add, they will add those on. So the average monthly cost of assisted living nationwide was $4,500 a month. Again, Alzheimer's and dementia care are going to cost more, absolutely more. But most of this is self-pay. So under most circumstances, you're going to have to depend on the clients paying for that room and board. Some in Ohio here, some people might qualify for Section 8 if you're interested in that support program, which is county support. Medicaid also will cover some assisted living services for people who are unable to pay. There are qualifications, and again, that's a system that you have to work through. It's a challenge, but once you get the arrangements worked out with Medicaid, it becomes easier. So again, it's one of the things you just have to work with Medicaid, whether you're in Ohio or any other state, you will have some type of Medicare assistance for long-term care. And again, it depends really on the physical and mental condition of the client, whether Medicaid would pay for it. So there's, again, Medicaid, if you have people who are eligible, they be maybe aged, disabled, etc. The payment is not huge. So there are a lot of facilities that do not take Medicaid. So you have to think about, are you interested and willing to work with Medicaid to make that happen? What's your motivation? Is it really to help these people find a place to live? Or if you're interested in making money, probably Medicaid is not for you. So the funding for mental health and addiction services, you have to go to their website and create an ID and then a profile, and they have a list of their funding opportunities, and they keep that pretty current. So if you're interested in mental health and addiction, that's the place to go. Again, they tell you very clearly what you need to do as far as space and facilities, but they also have, and training, but they also have funding opportunities. Possible federal funding, which the rest is state, but you want to look at this particular Substance Abuse and Mental Health Services Administration. Has funds available, and particularly if you take people who are homeless, you might get some further grants through there. So they have 2 block grant programs that you can look into and potentially apply for. Veterans mostly are going to be self-pay, but there are a couple of programs that veterans might qualify for, but they have to apply for it. It's not something that you can apply for them. So if you're thinking about a veteran home, think primarily self-pay. And these are just a short description of those programs. If you get funding from any type of government organization, these are some of the things you need to have in place. You need an agreement for any resident that comes on board. You need to disclose any issues that might be relevant. You have to have an admission and retention policy, a good description of your services, and if you contract with any outside organizations to provide services. So, you know, if you might provide catering, you might provide some types of activities for the clients that you contract with, you need to let them know. Whether or not you provide medication administration, what the staffing requirements are for your particular type of home, your training requirements, background checks, and inspections. So those are all things you need to be aware of if you want to do a group home. So where do you find more information? Again, you've got the Cleveland Public Library. And again, every state has, and every city has good libraries today. There's a research database called Insights that provides a lot of background information on various industries. Data Axle is very specific about particular businesses. You can go in and find out how long they've been in business, how many employees they have, what their gross income was for a particular period of time. So, and this is the Mergent Intellect is similar. So again, you can go in and do your research at the library, or if you want census data, you can go to the US Census. You want to look at specific diseases or other health-related information, the Center for Disease Control. Of course, you can always Google, and also go to trade and professional associations. The Ohio Administrative Code gives you information on nursing homes, adult foster homes, the Medicaid waiver program, halfway houses. So again, these are all resources that you can check on and find further information. What I've given you is basically an overview, but I've tried to give you additional information that will help you. But I will say, if you're starting a group home, it's so important to have someone to work with you, like a SCORE mentor. So with assisted living, do we need an RN to open up? The issue is what type of assisted living. If you're going to do anything like medication, any health-related stuff, you may have to have a nurse or a nurse practitioner. So you have to look into the regulations for the specific level of care that you plan to provide. Do you have to own the home you're using? No, absolutely not. You can rent it. That's fine. The issue is, can you provide the facilities the way that they're required by the agency that regulates that? So again, there's specific square footage. If you have people in one bedroom or two in a bedroom, you have certain facilities that you have to have, etc. So must you have a cook and a housekeeper? Again, it depends on the type of facility that you have. If this is a residential facility where you're providing room and board, again, it depends on the size and the regulatory agency. So you may or may not. It really, I hate to say it depends, but it depends. If you go to your local city, you can find out what the zoning regulations are. So again, it's a local thing, so you need to go to your local city. What is the difference between a group home under the Department of Developmental Disabilities and the mental health and addiction? Two different things. Mental health is not the same as mental deficiency and developmental deficiencies. Those are two totally different health issues. So mental health could be anxiety, it could be a lot of different things, whereas if you're developmentally disabled, that means you're probably mentally deficient, what we might have called mentally ill, or not mentally ill, but what would be the term? I don't know. It just means that you're developmentally disabled, so that your mind is not, your IQ is probably low, and you probably have other issues. So they're two different things. The difference between a group home and assisted living, there really is no difference. Assisted living can be a group home that has maybe 6 or 8 residents, or it could be a assisted living facility with 100 people. The regulations might be a little bit different based on size, but it all depends on what your purpose is. But a small group home would be at one end and a huge assisted living facility at the other end. But basically, they're all to help people who need a place to stay for one reason or another. So there's not that much difference. If you want to pull together 3 or 4 people, including your own loved ones, and create a group housing situation, do you officially need to start a group home? That depends, again, on I would say generally no. If the people are self-pay, but you want to look into your community and find out what their requirements are. Again, you're talking about unrelated people living in a home. And so there probably are some regulations by your city or your county. So you want to look into those and make sure that you're following them. Again, there's going to be your city housing might have the guidelines where they'll tell you how much space you need to have if you have more than your family living in your residence. So you want to look into that. Okay. If an existing group home is closing, the license might be able to be transferred. If the state isn't issuing, if you're talking about the Department of Disabilities, I would say you probably can. That would be something, I guess you'd have to go to the agency, because they would still want to do an inspection. They would still want to make sure that you meet all the requirements. But they might, if you have a deal with the one that's closing, they might be willing to talk with you about it. Again, all those links should be, if you put it in slideshow mode, all those links should be usable. Okay, you cannot convert from nonprofit to for-profit. Yes, you can. You have to go through your state, and you can convert from a nonprofit to a for-profit. Sometimes it's easier just to close one business and start another, but you can do it. So you can go to the state and work with them to make that change. Okay, I think I currently have a type B home daycare looking to open a center. Again, I would go to Starting Point. That's just such a great resource. It's a nonprofit and it goes through the training. It tells you exactly what you need as far as facilities and so forth. Just really a fantastic resource. The people there are really nice. I'm currently a DODD group home agency provider and looking for opportunities. Again, I would say go to um, get a SCORE mentor and they can help you dig in and figure out what to do. So where do we start on how to find a house? Again, my objective here was to give you an overview, not to go into detail about running a group home. Hopefully you will go and find a mentor who can help you. There are just so many things that you have to keep in mind when you're doing a group home. And again, it's a business. So what is the website for group home rules? Again, in the presentation, I have given you links to the various agencies that I'm aware of. And hopefully that will get you started. What if somebody wants to combine elderly daycare along with toddler daycare? That, again, I suggest a SCORE mentor, but that's something you might look into. There will be a couple of different regulating agencies that you need to work with. Is there a difference between having an agency and a group home? Well, in a way, yes, an agency is more providing services, and a group home is an actual residence. So, but again, somebody might call a assisted living facility, I guess, an agency, but in general, an agency provides services, not necessarily residential services, which is not to say they couldn't. Is it recommended to operate an addiction recovery sober living group home as a nonprofit or for-profit business? You could do either. I think it depends. I don't know that the Department of Mental Health requires one or the other. So I think there are a lot of things you have to take into consideration in making a decision. And I can't really give you that information. Will you explain the different phone numbers posted on the screen? Those are just numbers that you can call for information as opposed to looking at their website. So I think I pretty much covered all the questions, and I know that we're running pretty late and some of you have given up your lunch hour. So I think that we'll leave it at that. Again, I will put my email address in the chat. You are welcome to contact me with questions. But again, I do hope that if you're thinking of starting a group home, that you would contact us via our website, sign up for a mentor, and get the help you need to get started. It's, again, I would say it's wonderful. that you're starting or you're thinking about starting a group home. I know that there are lots of people who need help. And if that is your passion and your mission, again, we don't charge for our services. We're likely to be able to find someone who can help you. And so take advantage of SCORE and all the wonderful things we can provide you. So thank you for taking the time to attend. Again, you'll receive a copy of the slides and also a link to the recording, and you should get that in the next day or so. So I am going to stop share. Again, we're happy to help you in any way that we can. So I gave you my email address, and I hope that you have good luck in getting started.